Hello, I'm Michael Shea in Arlington County.
And I'm Andrew Wu, pediatrician here in Arlington County.
Thank you for joining us. This is
Behind the Mask.
So Andy, as a pediatrician in Arlington, what are some of the impacts you're seeing the pandemic is having on the community and its health?
Yeah, thanks for asking me that question. You know, we've unfortunately seen the effect of the pandemic over the last 2 years had an enormous impact on pediatric mental health. This morning I looked at an article that reported that from 2016 to 2020, which is at the beginning, shortly into the pandemic, that there was about a 25% increase in diagnoses of pediatric anxiety and pediatric depression. I think that, in terms of causes of this, I think there's a lot of reasons why this is. But when we think about mental health, there's a number of components that play a role in how we're feeling and emotionally and mentally. So I think there's the social component. Early in the pandemic, a lot of us were forced to socially isolate from one another and not be able to spend that kind of quality time with loved ones that allowed us to really connect as human beings. Our physical health tended to suffer as well. For kids, a lot of their sports teams, after school activities, recreational leagues and things were also canceled, and so they ended up spending all of their after hours on screens and devices and not being outside or not on an athletic field with their friends and taking care of their bodies. Eating suffered too during the pandemic. Everybody spent a lot of time at home, and while that initially sounds like a good thing, it's having 24/7 access to your pantry can be disastrous, when you're constantly exposed to the snack foods or maybe other unhealthy items in your kitchen. And so, we joke, but it's been true that there's been an increase in pediatric obesity. And so we talk about the COVID-19, where a lot of people have put on a lot of weight over the last couple of years. And for pediatric population in specifically, I've noticed that a lot of their mental health is very much tied into the mental health of their parents or their caregivers. And so we've also noticed that with parents and caregivers during the pandemic, they've suffered, their mental health has suffered a lot, especially early on when a lot of the child care and centers were closed, and working parents had to stay home and juggle both work and their children's education. And so that increased the anxiety rates for a lot of parents and adults and caregivers, and consequently, children often, we know that children whose caregivers or parents have anxiety are much more likely themselves to suffer from anxiety or depression. So there's been a lot of effects, unfortunately, from the pandemic.
What are some things you think schools and the community should be focusing on as you try to get back to better health?
Yeah, schools have been working tirelessly to support their students, and ever more so than now. I think that the guidance counselors at schools and school psychologists and therapists have a lot on their plate these days. I think that in general, just continue to be available for students. Some students are very much willing to come forward and ask for help, and they'll walk themselves over to the counselor and tell them that they're struggling, that they need some help. Sometimes the teachers will pick up on this and report a student to a counselor. But I've noticed a lot of the students and a lot of the kids who are suffering are flying under the radar. As a pediatrician, I see a lot of kids come to the office for a lot of physical complaints that appear to have no actual physical cause. And a lot of these students we're suspecting are suffering from undiagnosed anxiety or depression. So symptoms that I'm seeing include things like chronic abdominal pain, chronic headaches, difficulty sleeping, low appetite, maybe just sort of like a general disengagement, a loss of interest in activities. And finally, school performance issues. Kids who are doing well before maybe having a lot harder time focusing in school or getting their work done or engaging or just doing well in general. We're seeing a lot more cases of attention deficit hyperactivity disorder, also known as ADHD. So yeah, so I think it's just something collectively that educators, school teachers, and administrators alike can just be a little bit more cognizant of, realizing that, you know, for students and for young people, mental health can show up in a myriad of ways.
Andy, what are some good resources for people in the community to use if they want to be proactive and support the health of their family members and the community?
Yeah, there's a number of resources that are available. You know, we can start kind of more on the broad scale. So in the state of Virginia, there's a couple programs that are available for those who need support. So Virginia Mental Health Access Program, also known as VMAP, has put together an amazing collection of resources. So that's vmap.org/resources. There's also something called Bridges to Resources Virginia. So it's Bridges, the number 2, resources, va.org. Again, and in there, you know, you just have to enter your geographic location and it will hook you up with a number of social services and other resources in the area, depending on your needs. You know, I think in this day and age where everybody has a smartphone, there's a few personal ways that we can all kind of help ourselves. So there are several free apps, including something called Breathe with 2 E's, and then there are a few low-cost applications such as Headspace, Calm, and MoodKit. And so there's a number of others, but these are a few of the programs or apps out there that you can use personally to help with your mental health. And finally, I always encourage people to remember to take care of yourself personally. Back in the fall, I realized that I had stopped taking care of myself personally. So, you know, when it comes to personal health, I think there's a number of things we should focus on. So number 1, focus on your social health. As things open up, you know, with the weather warming up and being able to gather together outdoors, you know, reach out to friends you haven't seen in a while, okay? Because maybe we're all in the same boat and nobody wants to do the reaching out, but you'll be glad you did. 2, take care of your physical health. You know, the weather's getting nice out. Remember to go outside every day. Being outside has a number of benefits, including being a mood boost. It also encourages us to be active. Just even, you know, 30 to 45 minutes a day of moderate activity, such as fast walking or light jogging, is tremendous not only for your body, but for your mind. Remember to eat well. You know, we talked about this, but your brain is only as healthy as the food you put into it. And finally, I would say just remember to get enough sleep. You know, I think we're all so connected. We read so much news, we listen to so many podcasts, maybe we're always on Netflix or whatever it is that, you know, you find yourself glued to these days. Try to take some time to disconnect from the virtual world and reconnect to the real physical world. This will also help you with your mental health. This will help you with sleeping at night. You know, we use screens late at night, and this has detrimental effects on our sleep. And not getting enough sleep, as we know, has a detrimental effect on our mental health as well. So hopefully, you know, thank you for joining us today. Hopefully you've learned a few things and maybe were reminded of things that you ought to be doing, that you want to be doing again. So again, thank you for joining us and have a great day.
Well, Andy, I thank you and your fellow pediatricians for all the great work you do serving your patients and the community, and I wish you continued success.
Thank you very much.